for that reason. Sometimes we make our decisions based on our political affiliation without really digging into the meat of the matter. And we thought it would be, both humorous, which I think we all need, but also an important message to have two individuals who are on opposite ends of that spectrum say, you know what, as it pertains to the pandemic and getting out of the pandemic, we're all on the same side and we need to get vaccinated. That is the way out. So we thought that that would just be a good message to kind of jog people's memory and say, you know what, maybe I should look into this, not make a decision just based on my political affiliation.
And I know the goal is to stop some of this vaccine hesitancy, and President Biden had a goal of getting 70% of the U.S. at least partially vaccinated by July 4th. When I talked to Governor Evers late last week, he told me he thinks Wisconsin might only be at about 60% by that time. Why still the hesitancy?
Yeah, I think, there is so much information out there about vaccines, and a lot of that information is actually incorrect, and it gets people to a place where they have fear about getting this vaccine. They're worried about something bad that's going to happen if they get the vaccine. And, we just really need to do a better job of talking to those people, even one-on-one to say, hey, tell me your concern. I don't care how outlandish you think it is. Let's work through this so that you can make a good decision about this topic, which is really important. It could be a life or death decision.
Well, and you hear about some people who say, you know what, I'm not against the vaccine. I'm just not in any rush to get it because I'm young and healthy. And now we're hearing that could even pose a problem because of the variants out there. So what's your opinion?
Yeah, absolutely. I think, when people say they're young and healthy, they'll do okay. It's true that younger, healthier people do better, but there's a lot of young and healthy people that I've looked at in the hospital who weren't afforded that. They didn't do very good at all. So, don't take that risk just because you're young and healthy. We all need to get vaccinated because, one, it helps us, the young and healthy, but it also helps other people who aren't vaccinated or who can't make a response to the vaccine. We just all have to, roll up our sleeves, get this done.
And I also wanted to ask you, because Novavax could become the fourth available vaccine in the United States, any kind of timeline in terms of how soon Wisconsin could get something like that?
Yeah, I think, if Novavax can fit underneath the emergency use authorization, you could see it sometime in the fall. Now, it's possible the FDA will ask Novavax to get full FDA approval. I think you'll see Novavax used in other countries before you see it used in the U.S. And where I think Novavax probably has a place here in the U.S., maybe booster doses. So, at some point, we're going to find out that our immunity wanes from these vaccines or that we need a booster to cover a variant. And having another option that then allows all those people who are already vaccinated, hundreds of millions, to go ahead and get a booster quickly, that would be welcome.
Okay, Dr. Potoff, thank you. Good to see you.